you know, this is a global health problem. Every 20 seconds in the world, someone loses a leg due to diabetes. And this is just not acceptable, as many amputations are now preventable. How can we stop these amputations? We must understand the natural history of the diabetic foot and the role of the multidisciplinary diabetic foot team in reducing these amputations. The diabetic foot can be divided into two entities, the neuropathic foot and the ischemic foot. Furthermore, the neuropathic foot can be subdivided into the neuropathic ulcerated foot and the Charcot foot, and the ischemic foot into the neuroischemic foot, with both neuropathy and moderate ischemia, the critically ischemic foot with severe ischemia, and the acutely ischemic foot. Each of these 5 subdivisions have specific stages in the natural history as defined by the simple staging system. This is a system that covers the whole natural history of the diabetic foot, going from normal to high risk, and then the development of the ulcer or Charcot foot. At stage 4, the foot is threatened, either by infection or ischemia or both. And finally, stage 5 is the necrotic stage, where there is a high risk of amputation. The next slide shows the sequence of the stages in the 5 subdivisions, starting with the neuropathic foot. This is the high risk neuropathic foot with prominent metatarsal head, and at this point, callus develops and can lead to ulceration. The ulcer then can become infected, and this can lead to infective necrosis. More rarely, the high-risk foot can undergo some trauma, and this will lead to the Charcot foot. If this foot is not immobilized, it can become deformed, ulcerated, infected, and can lead also to infective necrosis. The high-risk ischemic foot is shown here, and this can develop ulceration along the margins of the foot. It also can become infected and lead to infective necrosis. Alternatively, the high-risk ischemic foot can suffer a severe reduction in blood supply, critical ischemia, and this is the pink painful foot of critical ischemia, which then can lead to reduction in perfusion and reduction of oxygenation and necrosis. And finally, the acutely ischemic foot, with a sudden reduction of blood supply, leading to cyanosis and widespread necrosis. So we can see in these natural histories that they can be rapidly come out of control during this passage from high risk to necrosis. And it's important that to avoid amputation, we have to restore control. That means controlling the wound, getting control of the mechanical aspects and the vascular aspects, and also achieving infection control, metabolic control, and educational control. And in any one patient, it is important to achieve control in all these entities. Furthermore, it is not possible for one discipline to achieve this range of control. And that is why the multidisciplinary team exists and is very important in reducing amputations. And it comprises podiatrist, surgeon, including vascular, orthopedic, and plastic, interventional radiologist, nurse, orthotist, and diabetologist. And this is a picture of the King's team with support and administrative staff, and pictures including people who are going to speak at this seminar, Maureen, Christian, Nina, and Professor Kapathapu. What are the important features that are crucial to the reduction of amputations? Well, it's important that there's a focus of care and acting in the diabetic foot clinic, The team should act in a coordinated manner and take part in joint consultations, and there should be rapid access to care for the patient, a patient-friendly pathway to the clinic. So this is a picture of our clinic, and in this clinic, we try to heal ulcers using plasters and orthotics. We accept emergency referrals. There are joint vascular diabetic foot clinics, joint orthopedic diabetic foot clinics, an outpatient antibiotic service, debridement and minor surgery, post-operative reviews and follow-ups, Charcot foot clinics, education and research, and overall a coordination of primary and secondary care. It's extremely important that there is a patient-friendly pathway to this clinic with an open access service to see emergency cases on the same day or within 24 hours, and taking referrals from all healthcare professionals, general practitioners, community podiatrists, community nurses, and also from patients. Recently, there have been 2 systematic reviews giving good evidence for the positive impact of the multidisciplinary diabetic foot team. The Albright review indicated that healthcare systems can expect a 39 to 50% reduction in amputation rate from multidisciplinary foot teams, and the Mezuzah systematic review reported that MDT teams reduced major amputations in 94% of studies. So in conclusion, we bring good news. Up until recently, the diabetic foot has defeated every healthcare system in the world, but advances in our understanding have led to improvements in organization of care and treatment, and most major amputations should now be prevented. Thank you for your attention.